Denver's message is as clear as any announcement on a DIA train, telling the unvaccinated today, you are delaying the departure of this pandemic. City of Denver is giving all its employees until the end of September to get vaccinated or get a new job. And the order extends to everyone who works in Denver's schools, hospitals, long-term care facilities, childcare, and shelters. Denver's order does not provide an opt-out for mandatory testing. Instead, it's get vaxxed or get out. We know that kids are low risk, but not no risk. So there's a push on to convince parents to vaccinate kids who are age eligible before they go back to school. A community clinic in Denver told our Victoria De Leon they're seeing hesitancy on vaccine for kids, even from vaccinated parents.
In Denver's Globeville neighborhood, there's a small clinic with a big responsibility.
Absolutely.
Tepeyac Community Health's Chief Health Officer, Dr. Pamela Valenza, wanted a better understanding of how the community feels about vaccines. So they surveyed about 100 people. She says 90% were Hispanic or Latino, and 97% said they were or planned to get a COVID-19 vaccine.
And there was only close to 3% who were still saying, well, I want a little bit more time to think about it, which is a very low percentage, especially in the Latino community.
Confidence dropped when it came to the children of people surveyed. Dr. Valenza says their concerns of safety were understandable. Most of them were about heart-related issues from the vaccine.
One of the ones that I think is at the top of a lot of parents' minds is myocarditis or pericarditis. And we know that the risk of myocarditis is much higher with a COVID infection than it is with a COVID vaccine.
Eligible kids and teens 19 and younger make up almost 9% of total vaccinations in Colorado. According to the state health department, that age group makes up about 13% of the eligible population. With the school year approaching, protecting those who aren't yet eligible for vaccines is top of mind.
In order to prevent another surge or another outbreak once we have a lot of school children going back to school, I think we need to look really carefully about who's vaccinated in those settings.
Dr. Valenza says the messaging surrounding vaccine safety in kids is the same as it is for adults. And while some concerns are understandable, she says it's worth it.
The benefits of the vaccine far outweigh any risks of the infection itself.
So Pfizer hopes to submit their vaccine for emergency use authorization in kids 5 to 11 sometime between September and October, and soon after for those 6 months to 5 years old. And then, Kyle, the process of building confidence in the vaccine for that age group starts. And Dr. Valenza, she says one of the best things that's worked for her patients is just having those one-on-one conversations to talk about the safety and effectiveness of vaccines.
Yeah, you think about it, Victoria, I mean, you got a population of 300 million people in the country, and it really has come down to just two people sitting across the table from each other talking about this.
Yeah, it really has, and she says it would not be possible without those many community partnerships that they do and with vaccine clinics.
Victoria De Leon, thank you very much.